All right, left versus right healthcare. Let's see what PragerU has to tell me. Pretty sure it's gonna be some kind of dishonest shit. Um, uh, can we say right wing healthcare is what we have right now in America? Because every other developed country has free healthcare, except for Japan, which still pays 70% of your healthcare bill. Can I like, can I call that right wing healthcare? The one where if you don't have health insurance, you're not gonna get healthcare because you can't pay for it. And also, even if you have health insurance, you're most likely not gonna go to the doctor because you can't pay off your deductible. And even if you don't have a deductible, you're probably not going to get all of the healthcare needs that you need to be fixed because your limit isn't high enough. So uh, you know, can we call that right wing healthcare? Sorry, I probably shouldn't poison the well like that. Um, I'm just gonna go ahead and play the video. But hey, I don't like America's healthcare system.
Hey, Pearson, and this is left versus right. Let's talk about the issue of healthcare. We'll start with some points of agreement. Nobody wants people to needlessly suffer from treatable illnesses or injuries, and no one wants someone ruined because of unforeseen catastrophic medical bills.
Right. Except for right wingers. Right, because I would just like to say there's no such thing as medical debt in other developed countries. That's not a thing that exists. It only exists in America.
The difference in opinion is how to achieve that goal. For the left, healthcare is a human right, and therefore should be provided to every citizen by the government. They say that everyone.
Exactly. No. Yes. Yes. Wait, he said it correctly, but there's something dishonest about this.
Has a shared responsibility for everyone else, so the cost should be shared by everyone through taxation. Those who have more, the wealthy, should pay more. That's why the left supports the Affordable Care Act, which has become known as Obamacare, after the president who.
No. No, Obamacare was a private healthcare act that bolstered private health insurance companies while also hurting them a little bit by not allowing them to keep people uh from being on their plans if they had a pre-existing condition. I don't think I think it would have been closer if you said universal healthcare. That's what healthcare through taxation is, not Obamacare. Obamacare is something completely different.
Produced it, Barack Obama. It greatly expanded the role of government in healthcare, creating a marketplace designed to make healthcare more affordable for everyone. Those on the right point out that Obamacare more than doubled health insurance costs for workers and families, with the national average premium increasing by 129% from 2013 to 2019. The right says that people should pay for their own healthcare, and the government should play a minimal role.
Right, because what you just explained is not the thing that you just showed. What you just explained, people getting taxed and then getting healthcare for it, is not Obamacare. See, those two things are not the same in any way, shape, and form. Okay, cool.
Promotes competition between healthcare providers and drives down medical costs. Only when someone is truly unable to afford healthcare should the government step in. The left says that if everyone had free healthcare, everyone would be healthier and costs would come down. The right challenges this.
That is fact, because this is how every other country in the world works, yes.
Because there aren't any examples where this has actually worked. Canada has universal.
What the fuck are you talking about? Okay, I need to know.
Healthcare and costs have gone up, while quality has gone down. For example, the average weight.
No, they still have better healthcare outcomes than we do.
Time to get an MRI in Canada is 3 months. In the US,
Hey, let's talk about average wait time to get an MRI in America.
you can get one in a day.
Let's talk about that, because that's not. Let's talk about that, because that's not completely true, is it? If you didn't have health insurance, were you gonna get that MRI? Be honest with me. Let's see. An MRI ranges from $346 to $726. If you didn't have health insurance, were you gonna get that MRI that you needed? Maybe it's an MRI. I mean, I would think you needed to get it right if you were getting one. But would you have done it if it cost that much and you didn't have health insurance? Really think about this. Remember that 60%, that's still most of Americans, live paycheck to paycheck. Now, let me expand the question. let's say you had health insurance, but your deductible wasn't high enough. Were you, well, I mean, but your deductible is like $5,000 before you get any of your benefits. Were you gonna get that MRI? Were you really? Really think about it. Okay, now once you have, okay, now here's the kicker. Once you have the good insurance and your deductible is zero, right? Okay. Once you're finally having the all of the necessary parts together to get that MRI, were you gonna be able to find a doctor within 2 months? Really think about this question, because I can't even find a primary care provider that can see me within 3. That's not possible most of the time, if ever. Um yeah, so like really, let's really be honest about it. Sure, you could get the MRI done in the day after you waited for your appointment. Oh, wait. Sorry, I forgot. I have to go back. Before you can see a specialist to get an MRI. Wait. Let me make sure. Let me make sure. Oh, you need a referral. So before you even get your referral to see the MRI doctor, you have to find your primary care provider. Like I said, I haven't been able to find one that's available to me for within 3 months. So there goes that number. So really think about it. Really think about which one you want, right? Do you want to only wait 3 months? Or do you want to either never be able to go anyway because you don't have the insurance, never be able to go anyway because you can't pay off the deductible, or not be able to go for 3 months anyway because you have to see a primary care provider to give you a referral to an appointment that's probably going to be scheduled out for another couple months? Which system do you want? Which one sounds better once you really lay out everything?
The left says that long wait times for government-run healthcare may happen, but that the quality of the treatment will not be affected. Everyone will at least get the same quality of care, even if wait times are long. But the right says if the government takes over healthcare, who is accountable when things go wrong? In a competitive situation, healthcare providers are subject to lawsuits, reputational damage, and the subsequent loss of business. But when the government is
Why does, okay, again, every other country in the world that is just as developed as America has already figured this out. This is not a question we need to be asking. This is not even a question that we ask currently with our current system. So I don't know why you're bringing this up.
in control, the consumer has nowhere to turn. The right believes there will be a better outcome if people are allowed to choose the healthcare services they want. And
You would be able to choose the healthcare services that you want under a universal healthcare system because you could just choose your doctor. But by the way, you also don't really choose your doctor under this system because some doctors are under your insurance, right? There's such thing as out of network, which means your insurance doesn't get taken into effect anyway. So that's kind of a kicker, isn't it? Choose your doctor, my ass.
providers who can best meet their needs. A 25-year-old is likely to have fewer health issues than a 55-year-old. Therefore, the 25-year-old policy should be much less expensive. The left counters by claiming
Right, except my policy is still $400 a month if I went to get private health care. And also, I get healthcare through my work, but it doesn't cover for jack shit. So, I mean, what am I supposed to do about that? Die, I guess.
that, sure, young people are subsidizing the system, but when they get older, someone will subsidize them, and that is only fair. Let's recap. The left wants healthcare to be paid for through taxes and administered by the government. They believe that if young and healthy people pay into the healthcare system through taxes, older and sick people will be able to have their expensive care covered. The right believes that through competition, the private sector provides more options and faster access for more people than a government-run program ever could. They believe while there are instances when a person might need government assistance for medical treatment, this should only be a last resort. Where do you stand?
Um, okay. I just want to hear that one more time.
Government-run program ever could. They
Except that's not true because you're not getting faster access. I just laid everything out. Even okay, best case scenario, you get to see your PCP within a week. You still have to find your specialist doctor after you get your referral. And specialist doctors are a bitch to schedule. So just because you can get it done in a day doesn't mean you're getting it done in a day. That's not the reality of the situation. But all right, whatever.
While there are instances when a person might need government assistance for medical treatment, this should only be a last resort. Where do you stand?
Right. Except we don't have that right because you still have to pay out the ass for the ER. So would the right say that is the right saying that the ER should be free? That's what I'm gonna comment. Oh, nope, I'm in incognito mode so that I don't have to. Ha. Oh well. All right. Oh shit, this is another 10-minute video. I can just upload this. All right, bye.